Anybody could come to Archer Family Healthcare, uninsured or insured, and I'm positive that they would be glad that they did.
Our model is very unique. It is a nurse-led clinic, so all of the providers are nurse practitioners. We have an integrated model where we provide primary care, which is your management of acute problems like upper respiratory infections, ear infections, pneumonia, something that's very acute. And then we also manage chronic diseases, so diabetes, hypertension, cholesterol issues, any of those chronic disease processes.
The College of Nursing was actually involved in the Archer community before I arrived at the college. Community health faculty members and students were visiting in senior centers and in schools. And of course, they noticed the lack of accessible primary care for people who were living in that community. And that's how the idea was born. Several community leaders had mentioned the need for accessible and affordable health care at Archer, and that was the beginning of the story. We did some lobbying, secured some state funds for startup, and we also, with the faculty's approval, we used faculty practice funds to start Archer Family Healthcare.
We have a unique practice, really. There's not very many practices in Gainesville and surrounding areas that have that integrated model. The other thing is people have a hard time getting into some of these providers, and we're always accepting new patients. We've expanded our clinic staff to accommodate those patients, so we're always trying to grow. We have a lot of patients that come from all over, Marion County, Levy County, Gilchrist County, so they come from all these surrounding areas to our practice.
They treat us like family. They make sure that I'm taking my medicine as needed. They make sure my kids are in good condition. They actually make me feel comfortable where I don't want to see no other doctor but them. Definitely Miss Denise, she's like my heart. She's so sweet. I wouldn't want nobody else. And to be honest with you, if they keep on doing what they're doing, I'm sure there's more people that feel the same exact way that I feel. Some days I'll be down, but you go there, they have a way of lifting you up and make you feel better, you know, and they have a way of making you smile. You go in there and you worried about one thing, and then you leave a whole nother other thing on your mind. So it's very positive there.
A lot of the patients have multiple chronic illnesses, so it's basically just bringing them back and seeing what they're due for, if they need medication refills, or if they have a new complaint, then we do new blood work for them. A lot of patients need referrals. Because of their insurance, we have to place those referrals. We see patients for if they've cut themselves, so we do it all here at the clinic.
I still refer people here. I just referred a couple of my friends here. Both of them are uninsured, and I tell them, don't worry, because your co-payment will be according to your income. If they need an EKG, if they need whatever type of care they need that day, they get it. And it's nothing extra unless it's labs. And then for labs, the practice has arrangements with the various labs like LabCorp and Quest, where the patients pay a huge reduced amount so that they can still get their labs done. I would want anyone to know that they can afford to come to Archer Family Healthcare, and they'll be glad that they did.
Many primary healthcare clinics, for example, don't include psychiatric and mental health services, but Archer broadened its mission to address those needs and others as they arose. It has an interdisciplinary part to it that also is somewhat unique, and we have had partnerships with medicine and pharmacy, as well as other community members, to make Archer Family Healthcare what it is.
I have been very lucky to have a combined role of teaching and practice, seeing our next generation of nursing students become nurse practitioners. So that is very rewarding to me first. And then also taking care of generations of families. So I take care of grandma, I take care of mom and dad, I take care of babies. Taking care of that whole family unit is probably the most rewarding thing.
The experience is definitely very different because you're not as comfortable in the role yet. There's still a learning curve that we have to kind of like navigate a little bit. Initially, that first patient that I walked into a room, like I'm sure I had jitters and was nervous and had no idea how to like guide the conversation. But through seeing it, through great mentors here such as Dr. Shintrup, through having that model like actually played out in front of me and being able to go in and basically like imitate it initially, but then you get your own style. The more you do it, the better you get. So that's how I've gotten better, is just practicing it.
Part of what has made Archer Family Healthcare special has been the care that is provided there by our expert faculty members and by the students who go to that facility to learn. I believe that patients are not rushed and that the care that they receive is personalized, and it's not limited to simply an office visit.
We look for different funding sources to help us take care of patients with no insurance, which is also unique because not very many places will take patients without insurance. So if anybody's interested in donating and helping out, they can go to our website, University of Florida College of Nursing, or they can call the College of Nursing and get in touch with our development office to make that donation.
I'm confident that the College of Nursing faculty members, graduates, and students will continue to develop innovative ways to address unmet healthcare issues and problems, and particularly among the underserved.